í menningunni á eftir. En við byrjum hins vegar á þessu. Sykur mesti skaðvaldur í vestrænu mataræði og meginorsök offituvandans ásamt sykursýki 2 og margra hjarta- og kransæðasjúkdóma sem herja á hinn vestræna heim. Þetta segir Dr. Aseem Malhotra, breskur hjartalæknir sem barist hefur fyrir sykurskatti í Bretlandi til að draga úr óhóflegri sykurneyslu þar í landi. Hann vísar því alfarið á bug að með skattlagningu sé forræðishyggjan við völd, heldur tali tölur sínu máli. Og besta dæmið það sé aukin skattlagning og hert regluverk í tengslum við sígarettur. Hann fullyrðir að það hafi borið árangur og dregið úr reykingum og það sama muni gilda sykurneyslu. Malhotra var einn af aðalfyrirlesurunum á Foodloose-ráðstefnunni sem haldin var í Hörpu í dag og fjallaði áhrif sykurs á heilsuna. En við ræddum hins vegar við hann snemma í morgun.
Welcome to the program, Dr. Malhotra.
Thank you for having me.
You have been campaigning against sugar and high-carb diet worldwide. Why?
Well, the first thing to say is, according to the Lancet Global Burden of Disease reports, poor diet contributes to more disease and death globally than physical inactivity, smoking, and alcohol combined. And the increasing evidence is telling us that sugar has now earned its place as public enemy #1 in the Western diet. This is something that we're consuming in very excess quantities. What people have only just realized recently is that added sugar, which is added to processed food, has no nutritional value whatsoever. And contrary to what the food industry has led us to believe, the body does not require any added sugar for energy.
What have you seen in your patients as a cardiologist, in terms of changed diet habits? Yeah. Can you give us an example?
In my 15-year career as a doctor, I've seen a huge change in terms of the demand on the health service, mostly being driven by diet-related disease. And actually, my patients now, when I give them advice on up-to-date scientific evidence, which involves reducing sugar and refined carbohydrates and eating more fat, actually, within a very short space of time, Helga, they have improvements in their health markers, and their risk of death is reduced within weeks.
What kind of improvement?
Well, you can look, so the root cause of this problem, which we have ignored for a very long time, the root risk factor is insulin resistance. And insulin resistance in men is more important risk factor for heart attack than high blood pressure, than high body mass index, than low HDL cholesterol, and much more important than what we have demonized wrongly for such a long time, or in excess, is the over-obsession and focus on cholesterol, LDL cholesterol. So when you target insulin resistance, and this means the right dietary changes, the right kind of exercise, people see the benefits very quickly. So in their blood markers, one of the things we look at are triglycerides and HDL. And within weeks, people's HDL, good cholesterol, can go up, and their triglycerides can go down. And that is actually a much more reliable marker of your risk of heart attack than anything else.
Just by taking out sugar and simple carbs?
Absolutely.
So why do we get insulin resistance?
It's a very good question. Insulin resistance is really multifactorial. In terms of diet, it's based upon people eating too many starchy or refined carbohydrates and added sugars. And also, it's now linked to increased consumption of vegetable oils that are high in omega-6, like sunflower and corn oil. Combine that with lack of activity, increased stress, basically a lot of what people are having to cope with in modern Western environment, then you've got a recipe for a public health disaster, and we're actually having to deal with the consequences of that now.
Has our health gotten much worse in terms of heart diseases and cancer? For example, the last 30 years?
Yeah, well, what's interesting is the biggest decline in cardiovascular death rates has happened predominantly because of reduction in smoking. But that has now started to plateau, and we're seeing trends that this may be increasing because of diet-related diseases. But cardiovascular disease globally, Helga, is still the #1 cause of death, responsible now for about 20 million deaths per year, and in the next 10 years, that's going to increase significantly.
And you think all this is because of bad diet?
I think poor diet is the most important factor for cardiovascular disease. 80% of cardiovascular disease in general is related to poor lifestyle factors, but the majority of that is because of poor diet.
Tell us how the dietary guidelines are now and how they should be in your view.
One of the biggest mistakes, in my view, that we've made in modern medicine is wrongly demonizing fat for the last 3 decades. And what's happened as a result, the population has increased their consumption of refined carbohydrates, processed vegetable oils, and it's caused an epidemic of type 2 diabetes and obesity. What we need to do is reverse those dietary guidelines and promote a dietary pattern that promotes whole foods, some of which are very high in fat, and very quickly people's health markers will improve.
Now, a recent report that was published in the UK called for changed dietary guidelines, said the medicine has been wrong the last 30 years, recommending low carbs, sugar-free, high-fat diet. This report has been criticised. A medical director of British Heart Foundation says this country's obesity epidemic is not caused by poor dietary guidelines, it is that we are not meeting them. Chief nutritionist at Public Health England said, in the face of all the evidence calling for people to eat more fat, cut out carbs and ignore calories is irresponsible. What is your response to that?
I think what's irresponsible is the fact that the establishment has misled us based upon flawed science, but continues to mislead us despite overwhelming scientific evidence to the contrary. And at the heart of our report, Helga, was the fact that we were attacking these so-called guideline bodies and the fact that they have been blinded or they're not changing according to the evidence in terms of their guidance. I'm not surprised they've come back and attacked us, because we were essentially attacking the establishment, and rightly so. There has been collusion between academic institutions, government bodies, with the food industry for financial gain at the expense of public health, and this is where the biggest scandal is.
But like the 30-year-old dietary guidelines on reducing fat or removing fat was maybe an extreme. Could this guideline on increasing fat and taking out sugar be extreme as well, or is this just pure science?
No, this is based upon the most up-to-date evidence, and in fact, actually, this overall guidance, when people read it in detail, is actually promoting whole foods, away from processed foods, no snacking, and actually promoting the kind of foods that are going to be very good for your metabolic health and improve your health outcomes as well. So this is foods such as oily fish, extra virgin olive oil, nuts, lots of non-starchy vegetables, some fruit, you know, and removing all of the refined and starchy carbohydrates and sugars, which, Helga, in particular, are very problematic for people with type 2 diabetes. One of the biggest scandals, if you like, is the misinformation about the management of people with type 2 diabetes, telling them they should base their meals on starchy carbohydrates. Type 2 diabetes is a condition of carbohydrate intolerance. So telling type 2 diabetes to eat more starchy carbohydrates, in effect, is like telling someone with a nut allergy to eat nuts and carry around an EpiPen. The only people benefiting from this are going to be the food industry and the processed food industry, and actually the drug companies, let's be honest, because actually there is a huge market around diabetes drugs, and in fact a lot of these diabetes drug companies, they sponsor these you know, so-called guideline bodies, and that contributes to this misinformation. What we need to do is actually reverse type 2 diabetes, which can be done and has already been done by a GP in England with many of his patients by ignoring the conventional guidelines, cutting out the refined carbs and sugar, and advising his patients to do so. And he has managed to reduce medications, take people off insulin, and even reverse type 2 diabetes in his patients. We have that real-world evidence.
But fat isn't fat, so you're saying people can't always, every day, binge on bacon, for example?
No. This is, again, this is not a processed food. I mean, bacon is a processed food. I have no issue with bacon occasionally, but this is actually promoting whole foods. But what it means is actually, I'm glad you've raised this, because when people don't eat macronutrients, they eat food. But foods that are higher in fat tend to keep you fuller for longer, and also, they also have the least impact on insulin and glucose responses in the blood. And if we know that insulin resistance is a big cause of these problems, clearly eating more fat is going to be one of the mechanisms to reduce insulin resistance. And Helga, to be honest, I used to follow conventional advice. I've always been active. I've been a sportsman. I've captained sports teams at school and university. Yeah, I followed conventional advice, and my food used to be sugared cereal in the morning, orange juice, go to the gym before going to work, bottle of Lucozade. Mid-morning, I'd be hungry again. I'd have a chocolate bar, then I'd have pasta and a panini for lunch, and then this cycle would continue. I'd always be hungry, and I thought this was normal. And when I looked at the data and the evidence and realized I'm harming my health, I actually changed my dietary pattern to the one that we've recommended, based upon the evidence, and I don't feel the same hunger anymore. I can eat 2 or 3 meals a day. I feel energized. I didn't do it for the purposes of losing weight. I did it for health, but by chance, I lost about 1 stone of weight around my belly. And actually, I know I'm in much better metabolic health and certainly reducing my risk of heart disease.
But you advise people to remove sugar from the diet. That's easier said than done. There is sugar in bread, ketchup, dairy products, whatever.
Helga, it's a very good point you raise, and that's why we need government regulation, because sugar has become almost unavoidable. Hidden sugars. Foods that are being marketed as healthy by the food industry, but are loaded with sugar based upon this low-fat message. And that's why government need to intervene to remove this, what I call an environmental toxin, which is when it's consumed in excess, a food environmental toxin when consumed in excess. And if we do that very quickly, we would reduce the burden of obesity and type 2 diabetes. Just to give you one example, Oxford researchers did a study modelling on what would happen if we had a 20% tax on sugary drinks in the UK. And they calculated within 1 year, it would prevent 180,000 people from becoming obese and more than 200,000 people from becoming overweight.
But some people say that regulators can't stop the consumption. They don't have any effect, you know. How can we change that?
Well, I think we must learn from history. The biggest decline in cigarette consumption happened because of regulatory processes targeting what we call the 3 A's in public health. The availability, the affordability, and the acceptability. We can apply the same principles to sugar. Taxes, make it more expensive, less consumption, reduce the availability. You know, public smoking ban, which happened. Very quickly, there was a reduction in hospital admissions for heart attack within a year. And I think for sugar, we can apply the same principles. And if we do that through government intervention, then we are actually very quickly going to reverse this epidemic of type 2 diabetes and obesity and make the population healthier and happier.
Thank you for being with us.
Thank you, Helga.
Þá að allt öðru. Alþingi